I'd like to welcome you to the next in our series of infectious disease training programs, this one on influenza viruses, including seasonal influenza, avian influenza, and pandemic flu. As before, I'd like to acknowledge Dr. Alex Isaacoff from the Section of Pre-Hospital and Disaster Medicine, Department of Emergency Medicine at Emory, for use of his slide set in this presentation. First of all, general orientation to seasonal influenza. There are several different types of influenza viruses. The most common ones that we encounter include influenza A and influenza B viruses. Those are the ones that tend to cause flu epidemics in humans. And then of influenza type A, there are various subtypes such as H1N1, H3N2, and of course many others. Influenza B, which is further characterized by the area in which it's isolated, the laboratory and the year of isolation to characterize the strain, and influenza C, which can cause human disease, although it's not a very prominent cause and is not thought to be a cause of epidemics. So what do the H and N refer to in the type A influenza viruses? They refer to surface proteins known as the hemagglutinin and neuraminidase, respectively. Of the H form, there are 18 subtypes currently known, and of the N form, there are about 11 subtypes currently known. So many different varieties can potentially exist. The hemagglutinin is used by the influenza virus to attach to the host cell to gain entry prior to causing infection, and the neuraminidase is utilized to escape from the cell after the virus has reproduced and as it's on its way towards infecting other cells. Seasonal flu is a highly contagious respiratory illness. It causes a variety of symptoms, I'm sure well known to this audience: fever, chills, cough, sore throat, muscle aches, which can be very severe, headache, and fatigue. And it's stated that these symptoms often come on very rapidly, such that one may feel entirely normal 1 minute and then over a period of just a few minutes start to feel very, very ill, usually again with fever, chills, and aches. Seasonal flu is transmitted by direct and indirect contact with infectious droplets. Because they are droplets, they are spread over a range of usually up to 3 to 6 feet, a radius of that distance from the infected individual. Viral shedding, interestingly, can occur prior to onset of symptoms, up to 1 day or 24 hours before onset of symptoms, so it's very difficult to prevent transmission person to person, since even before an individual has any manifestations of illness, they can be infectious. The onset of symptoms usually occurs 1 to 4 days after exposure to an infected source. Several groups have a risk for more serious illness with flu, seasonal influenza. Those individuals being the elderly, persons over age 65, and very young children, pregnant women, and persons with chronic medical conditions, including but not limited to asthma, diabetes, and heart disease. There is a vaccine as well, of course, and we have a different vaccine that appears each year in association with different strains that are in circulation. It is stated by many individuals, if you're a clinician, you've certainly heard this more than once, that people claim they have gotten the flu from the vaccine and therefore don't want to receive it again. This is not actually true. The vaccine itself is inactivated. It's a killed virus and is not capable of causing infection. Nonetheless, people can have adverse reactions or symptoms associated with it based on either an allergy or a direct effect of some of the components of the vaccine, and can feel achy or tired or sore, and occasionally can get fever associated with that, but they don't truly get influenza associated from the vaccine. The effectiveness of the virus, of the vaccine, will vary each year depending on the match between the strains that are included in the vaccine itself and the strains that are in circulation across the world. Some years the match is excellent and the vaccine is highly effective. Other years the match is less than perfect and effectiveness is 50% or lower. The Food and Drug Administration, looking at World Health Organization data each year, will make a selection about the strains to include in the vaccine, and that process has to anticipate what is likely to occur, and the result is not necessarily perfect because strains may emerge at a later time after the date at which the strains are selected for vaccine.